Every year, millions of Australians ask themselves the same question. They look at the premium coming out of their account, look at the fact that we already have Medicare, and think, am I actually getting anything for this, or am I just paying to feel responsible? It's a fair question, and the honest answer is not the one either the insurers or the cynics want you to hear. Private health insurance in Australia is not a simple yes, it's worth it, or no, it's a scam. It's a decision that's been deliberately rigged by government policy, and once you understand how it's rigged, the answer for your specific situation becomes obvious. So, in the next 10 minutes, I'm going to explain how the system actually works and a simple framework to know whether it's personally worth it for you. Welcome back to the channel. If you want clear, no spin breakdowns of money decisions Australians actually face, please hit subscribe and like the video, it helps me out a lot. So here's the plan. First, how the Aussie health system is set up, because that's the whole reason this question exists. Then the three government levers that quietly push you toward buying cover. Then what you're actually paying for. And finally, the verdict. Who it's genuinely worth it for and who's better off keeping the money. Start with the thing that makes Australia different. We have Medicare. If you get hit by a car tomorrow, you go to a public hospital, you get treated, and you don't see a bill. That's not nothing. In a lot of countries, that single sentence is the entire dream. So the obvious question is, if the public system already catches you, why would anyone pay for the private cover on top? And the government's answer is basically this. The public system is brilliant in an emergency, but it gets stretched out for everything that isn't life-threatening. If you need a new hip, or a knee reconstruction, or anything elective, you can wait. Sometimes months, sometimes a lot longer. So the government wants people who can afford it to use private hospitals instead, to take the pressure off the public ones. But here's the catch, they can't force you. So instead, they built a system of carrots and sticks to push you in that direction. And those carrots and sticks are the real reason this decision is so confusing. Let's pull them apart. There are three government mechanisms that distort this whole decision. Understand these three and you understand everything. Lever 1, the Medicare Levy Surcharge. Almost everyone pays a flat Medicare levy, a small slice of your income that funds the public system. Fine, but if you earn above a certain threshold and you don't hold private hospital cover, you pay an extra penalty on top. It's called the Medicare Levy Surcharge, and depending on how much you earn, it adds roughly 1 to 1.5% of your income. Check the current threshold, because it's indexed and rises most years, but as a rule of thumb, it kicks in somewhere around the six-figure mark for a single person and roughly double that for a family. Here's why this matters so much. Above that threshold, you might be paying the surcharge for nothing. You get no cover, no benefit, just a higher tax bill. And often, a basic hospital policy costs about the same as the surcharge you'd otherwise be paying. So, for higher earners, the question stops being insurance versus no insurance and becomes a pay the government and get nothing, or pay roughly the same and at least get a policy. When you put it that way, the math changes completely. Lever 2, the private health insurance rebate. This one's a carrot. If you do take out cover, the government chips in to help you pay your premium. For most working-aged people in the base tier, that's roughly a quarter off the cost, though it phases down as your income rises. So the sticker price you see advertised is not always what you'll actually be paying. It's worth remembering when you compare it to the surcharge. Lever 3, and this is the sneaky one, lifetime health cover loading. This is the lever most people don't find out about until it's too late. The rule is simple. You're meant to take out hospital cover by the 1st of July after your 31st birthday. If you don't, then every year you wait adds a 2% loading on top of your premium once you eventually do sign up. So, if you hold off for 10 years, you're paying 20% more every year for the same cover. It's capped, but the cap is high, up around 70%. The one bit of good news, once you've held cover continuously for 10 years, the loading drops off. The point of this lever is to scare young, healthy people into the pool early so the whole system stays affordable. And love it or hate it, it works. Because it means the I'll just sign up later when I actually need it plan quietly gets more expensive every single year you delay. So, that's the machine. A penalty if you earn a lot and stay out, a subsidy if you come in, and a clock that punishes you for waiting. None of these levers are about whether the insurance is genuinely good value, they're about steering your behavior. which is exactly why you have to separate the policy nudges from the actual product. So let's look at the product. Private health insurance comes in two flavors, and people constantly confuse them. The first is hospital cover. This is the serious one. It's what gets you treated as a private patient, choosing your own doctor, and often skipping the public waiting list, and usually getting your own private room. And importantly, hospital cover is the only one that counts for the surcharge and the loading. The other stuff doesn't. The second is extras, sometimes referred to as ancillary. This is the everyday stuff: dental, optical, physio, that kind of thing. Extras is basically a budgeting tool, not a real insurance. You're preparing for services you'll probably use and getting some of it back. For a lot of people, extras is close to a wash. You claim back roughly what you put in, give or take. Now, three things the ads won't lead with. 1. Gaps. Private cover often doesn't pay the whole bill. There can be a difference between what your specialist charges and what the funds pay back, and that gap comes out of your pocket. It can be a genuine shock. Number 2, you generally can't sign up for the week before a planned procedure and claim straight away. There are waiting periods, especially for pre-existing conditions, which is the system's defense against people only joining when they're already sick. 3. Junk policies. Some of the cheapest hospital policies exist mainly to dodge the surcharge while covering almost nothing useful. They technically tick the box, but if you ever actually need them, you'd find out the important stuff is excluded. So, I got the cheapest one to avoid the tax, can leave you with cover that's worthless when it counts. Read what's excluded, not just the price. Let me give you both sides straight, because this genuinely cuts both ways. The case for it: you get speed and choice. No waiting list anxiety for elective surgery, your pick of a surgeon, and more control over the when and where. If you've got a known issue, or you're planning a family, or you just deeply value not waiting, that peace of mind is real and it's worth paying for. And if you're a higher earner, you're effectively getting it at a discount because you'd be handing over the surcharge anyway. The case against: if you're young, healthy, on a modest income below the surcharge threshold, the cold maths often don't stack up. You'll likely pay more in premiums over the years than you ever claim back, and for an emergency, the public system already has you. In that situation, you could argue you're better off taking that premium money, investing it, and self-insuring with a buffer of your own. Both of those are true at the same time. The right answer just depends on which person you are. So, is it worth it? Here's the framework. Ask yourself 3 questions. 1. Do you earn above the surcharge threshold? If yes, the scales tip hard toward getting cover, because you're paying a penalty regardless. You may as well get a real policy out of it. Question 2. Are you near or past that early 30s loading deadline? If you're approaching it and you think you'll want cover eventually, the clock is the strongest argument to start now rather than later, because waiting just makes it permanently dearer. Question 3. Do you actually value private treatment? Be honest. If choice and speed genuinely matter to you, or you have foreseeable health needs, that's worth real money and the insurance delivers it. If you are a higher earner, near the loading deadline, who values choice, then yes, it's clearly worth it. Get good hospital cover and skip the junk. If you're young, healthy, on a lower income with none of these pressures, it's defensible to keep the money, invest the difference, and lean on Medicare as long as you're going in with your eyes open about that loading clock ticking. The mistake is treating this as a moral question. Like buying cover makes you responsible and skipping it makes you reckless. It's not. It's a maths question with 3 inputs: your income, your age, and what you actually value. Plug those in honestly, and the answer stops being confusing. So, private health insurance in Australia isn't a scam, and it isn't a no-brainer. It's a system designed to nudge you, and your job is to see the nudges clearly and decide your own terms. If this made the decision clearer, give it a like so it reaches more people staring at that premium wondering the same thing. Subscribe for more straight-talking Aussie money breakdowns, and tell me in the comments, are you in, are you out, and why? See you in the next one.